Hello everyone, myself Ruchi Patel, working as an assistant professor at LJ College of Physiotherapy. Today I am going to take second year topic, that is pelvic tilt. So let's start with the presentation. So pelvic motion along with the hip and vertebral column we use to mention the pelvic tilt. So pelvic may be inclined or tilted in a following ways, like anterior pelvic tilt can occur, posterior pelvic tilt can occur, pelvic hike, pelvic drop, and pelvic rotation occurs. So anterior and posterior pelvic tilt can be measured with the help of lumbosacral angle, with the help of pelvic inclinometer, and by drawing the vertical line. So lumbosacral angle, it is the parallel line which is drawn parallel to the ground and the line along with the base of the sacrum. So here we can see this that this line which is parallel to the ground, that is the horizontal line, and the another line which is passing from the base of the sacrum. Okay, so this makes an angle which is called as the lumbosacral angle, and normally it is around 30 degree. If it is increased, then we can say that produces the lordosis. Okay, and if it is decreased, that produces the posterior pelvic tilt. The another method for measuring this lumbosacral angle, that is the pelvic inclinometer. One arm of the pelvic inclinometer will keep at the PSIS level, whereas the other arm of the pelvic inclinometer will keep at the pubic symphysis. And in this, we'll get the angle, reading will get, and accordingly, we can decide the whether it is normal or it is abnormal. So we'll see first anterior pelvic tilt. Anterior and posterior pelvic tilt are the motion of the entire pelvic ring and which occurs in the sagittal plane and coronal axis. Okay, so here if we see that normally the whenever we observe or whenever we examine the pelvis, that is ASIS will be the parallel to the will be in the same line with the PSIS, whereas the vertically it is present just near to the pubic symphysis. So whenever we draw the line from the ASIS to the pubic symphysis, that will be in a same vertical line will get. Okay, so now based on this, if we are considering this ASIS, pubic symphysis and sacrum, then we can say whether it is a posterior tilting or anterior tilting. So first we'll talk about the posterior tilting. So whenever we talk about the posterior tilting, then we can say that this sacrum is coming closer to the femur. This arrow is indicating the direction of the movement at the sacrum level. So we can say the sacrum is moving towards the femur, whereas this pubic symphysis is moving in the upward direction, or in another way, we can say ASIS move in the posterior direction. Okay, so whenever we talk about the anterior pelvic tilt, so we can say that during the anterior pelvic tilt, the arrow is indicating that sacrum is moving in the upward direction. ASIS moves in the forward and downward direction. Okay, so this can be occurs during the anterior pelvic tilt. So now we'll see in the detail that in the normally aligned pelvis, the anterior posterior iliac spine, that is the ASIS of the pelvis, lies in a horizontal line with the PSIS, and that will be lies in a vertical line with the symphysis pubis. So here already we have seen this ASIS lies in a horizontal line with the PSIS and lies in a vertical line with the pubic symphysis. Okay, so anterior and posterior pelvic tilt will be occur on the fixed femur. Okay, so it can produce the hip flexion and hip extension motion respectively. So after this, we have seen this image. Then we can say during the hip extension through the posterior pelvic tilt, the pelvis bring the symphysis pubis up and the sacrum of the pelvis closer to the femur. As we have seen here, that pubic symphysis is moving upward and sacrum is moving closer to the femur. And during hip flexion, the anterior tilting of the pelvis that moves the ASIS anteriorly and inferiorly, and inferior sacrum move further away from the femur. So as we have seen here, that here this ASIS moves in a anterior and inferior direction, and this sacrum is moving away from the femur. Okay. So for excessive anterior pelvic tilt and for excessive posterior pelvic tilt, which all muscles are responsible? So if your hip flexors and spinal extensors are tight and your hip extensors and spinal flexors are weak, that can produce the anterior pelvic tilt, excessive anterior pelvic tilt. Whereas opposite of this anterior pelvic tilt, that is here the weaker muscle will be hip flexors and spinal extensors, and tight muscles will be hip extensors and spinal flexors muscle. Okay, so here you all can see for the anterior pelvic tilt, this iliopsoas and erector spinae will be tight, and gluteus maximus and these abdominal muscles will be weak. Whereas in the case of excessive posterior pelvic tilt, these iliopsoas and erector spinae muscles will become weak, whereas gluteus maximus and abdominal muscles become tight. So here you can see this is the excessive lordotic posture, and here the backward movement of the trunk is seen. Okay. Okay, then next is the lateral pelvic tilt. So this lateral pelvic tilt occurs in the frontal plane and in the sagittal axis. So how this motion is occurring, we'll see here. So if we say that in the normally, if we are standing or giving weight on equally on both the lower extremity, then the horizontal line which passes from the both the ASIS will be in the same line, and one line which is passing from the femur. Okay, so here this angle is formed. Okay, so now whenever I say hip hiking and hip drop, or pelvic hike and pelvic drop, that means I am talking about the one of the uh, extremity which is not in contact with the ground, or we can say that extremity is not taking the weight. Okay, so here if I say right hip hiking, that means my right hip is in the non-weight bearing position. Okay, so here this right hip hiking means right hip is going in the upward direction, right pelvis is going in the upward direction, and the reference extremity or the weight bearing extremity is left extremity. Here, this ASIS, both the line which is passing from the both the ASIS and vertical line, that makes an angle and is increasing. So on the weight bearing extremity, this abduction movement is occurring during the pelvic hike. Okay, so here this negative arrow is indicating that if I have mentioned right hip hiking, then don't see that the your left, this arrow is indicating here, so that does not mean you have to see about um, the angle on the right side. You have to see this angle on the weight bearing side, and the hike will be on the opposite side. Okay, then next we have that is the related to the right pelvic drop. So here this right extremity is going for the pelvic drop, and the angle between this ASIS and the femur is getting decreased. So here adduction movement is occurring. Okay, so next we'll see. So here you all can see this person is taking the weight only in the one extremity, and pelvic hike and pelvic drop is occurring on the right side extremity. So lateral pelvic shift. So when we talk about bilateral extremity, when both the extremities are in the contact with the ground, and when we talk related to the tilt, that is called as the lateral shift. Okay, so we'll see with the one good example. Here the person, both the extremities are in the contact with the ground, but the maximum weight is taken by the right extremity. So whole body is shifted towards the right side. The left extremity is knee and hip is getting slight flexed position. That is not taking the weight. Okay, so weight is all the weight is getting by taken by the right extremity. So here you all can see that uh, this side the shifting is occurring, and on the left side there will be the pelvic drop. So whenever we talk about the bilateral extremity weight bearing, that time always hip drop or pelvic drop occurs. There will be never hip hike is possible or pelvic hike is possible. Always during the both the extremities in the weight bearing position, then always the pelvic shift will be on the one side, and always on the other side there will be pelvic drop. Okay, then last we have pelvic motion or pelvic rotation motion, and it includes the forward rotation and backward rotation. So, of course, as we all know, that movement can occur in the transverse plane and around the vertical axis. So, whenever the forward rotation of the pelvis occurs, the unilateral on the unilateral stance, that the hip joints moves in the anterior direction. Okay. So, whenever the forward rotation of the pelvis occurs in the unilateral stance, when the side of the pelvis opposite to the supporting hip joint will move anteriorly. So the non-weight bearing hip will go for the forward rotation. Okay, so forward rotation of the pelvis produces the medial rotation of the supporting hip joint. Okay, so forward rotation will occur on the swing extremity, and or we can say non-weight bearing extremity, and the medial rotation of the hip occurs on the weight bearing extremity, and the opposite, that is backward rotation of the pelvis occurs when the side of the pelvis opposite to the supporting hip moves posteriorly. So whenever the hip is moving in the posterior direction, that time backward rotation will occur, and posterior rotation of the pelvis will produce the lateral rotation of the supporting hip joint. Okay, so this is related to the pelvic rotational movement. So reference book are the therapeutic exercises by the Lakshmi Narayan, joint structure and function by Cynthia Nordkin, as well as principles of exercise therapy by Dina Gardiner. So you all can refer this topic from these three books. Okay, thank you.